Hi guys, welcome back to Oman. Hi guys, welcome back to Oman again. Yes, I'm back guys, and I'm here with another video. Today is my day 4 of isolating. Yes guys, I caught COVID at the hospital because I'm a doctor, in case some of you guys don't know, and I've been very extra careful, like wearing my face mask, washing my hands like regularly. I even tell my colleagues, like, please wear your face mask, that patient, wear your face mask, be careful. And then I was the one that caught it. Yeah, I've been isolating, but today is my day 4. In the past they used to give like 2 weeks for you to go isolate, get better, but now apparently the number of days has been reduced to 7 days. So I've just been resting, taking my vitamins, drinking a lot of water, taking fruits, and taking my medications as well. So please make sure you put on your face mask, because COVID is still in circulation right now. There is a new strain of COVID, so please stay safe and wear a mask. Moving straight into the video, today I'm going to be talking about a very important topic that affects our society. I'm just trying to get comfortable with that, so I'm just like I'm going to be talking about cervical cancer. Yes, cervical cancer is a very sensitive topic. It's been affecting our women in this society, and so let's talk about it. What is cervical cancer? Cervical cancer is a cancer of the cervix, and the cervix is the neck of the womb. So we have the womb, right, or the uterus. It's this pear-shaped organ that helps to carry a baby throughout pregnancy. Also helps with your menstrual cycle. This is the shape, right? I'm going to put a picture here, and then it goes down this way. So the ending of the womb is called the cervix, and so in that area can be exposed to infection, can be exposed to cancer as well. So that's why it's called cervical cancer, like cancer of the cervix. According to statistics and according to Medscape, cervical cancer can be seen in about 4 to 10 women out of 100,000 women, and as of 2022 it was seen in about 800 women out of 100,000 women between the ages of 25 and 29 years old. But the peak age at which cervical cancer can be seen is from 35 to 44 years of age. So women between this age bracket have to do regular pap smear, which we're going to get into later, which is one of the ways of preventing cervical cancer. Next, we're going to be talking about the cause of cervical cancer. What usually causes cervical cancer? According to studies, it has been found to be caused by the HPV, or the human papilloma virus. Now, this virus can be gotten or contacted from sexual intercourse from men. Yes, men actually have this virus, but it doesn't cause any pathology or illnesses in them. But then when they have sexual intercourse with a woman, they can transfer this virus to a woman. We have different types of the HPV virus. We have the type 16, we have this type 18, we also have other types like 31, 33, up to 68, but the main HPV that usually causes cervical cancer are the type 16 and 18, and we have vaccines for them. Talking about the risk factors that usually expose women to having cervical cancer, so it's not just about having this HPV virus or contracting it, it's also having other factors that then merge together and then cause the cervical cancer. So what are these risk factors? If a woman had sex or sexual intercourse at an early age in life, let's say from age 9, 11, so this is a risk factor, because the longer or the more early she has sex, the more she's exposed to that HPV virus, and the longer the exposure to this virus, the more you are at risk of getting cervical cancer. I hope you guys understood that. Early age at your first pregnancy. So for example, you got pregnant at 2018, you have a higher risk of having cervical cancer in the future. Having multiple sexual partners can expose a woman to having cervical cancer, because the more you have different partners, the more you're at risk of getting this HPV. Smoking, smoking can predispose a woman to having cervical cancer, and also long-term use of contraceptive pills or contraception pills. Those are the OCPs. Many articles have proposed that the link between these pills and cervical cancer is that the pills dysregulate the hormones that is produced in the woman's body. So those hormones now feed the cancer cells to replicate or to multiply. So that's why there has been a link found between the pills and cervical cancer. We're going to be talking about the signs and symptoms. How do you know that you have cervical cancer, or you're suspecting that you may have cervical cancer? Now, during the early stages of cervical cancer, there's usually no signs and symptoms, so a woman may not know. But later on, one may begin to experience vaginal bleeding. She may also have bleeding during or after sexual intercourse. They may also experience discharge from their vagina, and this discharge can be foul smelling. A woman can have pain during or after having sexual intercourse. So once you notice all these things, you're like, okay, let me go and check myself out. But then these are the later stages, so it's always better when you reach a certain age, always go for a pap smear test. Next up, we're going to be talking about how to treat cervical cancer. I don't know what I'm doing like this. So the treatment of cervical cancer is based on the stages. For cancers in general, we like to stage it so that we know what is beneficial for this patient and what you need to do for this patient. So once you stage the cancer and you say, okay, it is in scene 1 or scene 2, scene is actually, it's transforming, right? It's not really a cancer, but it's transforming. So you need to stage it according to that, and then stage it into stage 1, 2, 3 and 4. And so once you stage it into that, you know, okay, this patient requires chemotherapy, or that patient requires surgery. Generally, we just prefer to do surgery when necessary, and then if this cancer has spread to neighboring organs or the rest of the body, we prefer to do chemotherapy or radiotherapy. So basically depends on the size and the spreading of the cancer. Now, how do we prevent cervical cancer from happening in our society, in our families, in our lives as well? So the first thing is to create awareness, which is what I'm doing now. So just telling other people about cervical cancer, that it is real and it happens in women, and so they can take precaution. They can take precaution in reducing the number of sexual partners and reducing the number of children that they give birth to, and making sure they go for pap smear test, which is a test to do to see if there is any abnormal cervical cells or if you are fine. Another way of preventing cervical cancer is by taking your vaccine. There are vaccines for cervical cancer. We have 3 vaccines available at the moment, if I'm not wrong. We have the Gardasil 9. We also have the Cervical vaccine, Gardasil 4 vaccine. Now, all these 3 vaccines help to protect against human papillomavirus 16 and 18 types. Also spreading the word through radio, TV, and just telling other people about it really helps reduce the incidence of cervical cancer, because no woman should die from cervical cancer. No woman should die from childbearing. No woman should die from things that can be easily prevented. So the vaccines are actually available in 3 doses, and in Nigeria currently the last price I heard, it's about 65,000 naira. So for the 3 shots, and you can get these vaccines from any general hospital near you. I'm not sure about the private facilities, but I know that you can get your vaccines, HPV vaccines, in any general hospital near you. So please try your best. You are sexually active and you're a woman, please get these vaccines, okay? And also in the developed countries, they actually give the vaccines to even young ladies as soon as they reach 13, even some around the age of 11. I think America is 11, some other countries is 13 years old, because usually in these climes, of course, people usually tend to get sexually active at that age, so that's why they give them at that age. So guys, I hope you enjoyed this video. Thank you for watching and taking time to listen to me. make sure you like my video. Just go to the subscribe button and click subscribe. So do let me know what kind of videos you would like to see on my channel, and then I'll do my best to make them and then drop them. Also, if you have any more questions about cervical cancer, please leave them in the comment section and I will respond to them ASAP. Thank you for watching Oman, and see you in my next video. Bye.